Hi, everyone, and welcome into Conversations with Dr. Charles Ackle. I'm Pat Bryant, the head of branding here at Emmy. And have you heard about post-viral syndrome? You heard a lot about COVID-19, and we're going to talk about post-viral syndrome today and go deep with Dr. Charles. If you don't know Dr. Charles, he is the chief medical officer here at Emmy. He's a fellow of the Royal College of Surgeons and did his medical study and work at Guy's Hospital in London. And Dr. Ackle, you have trained many a surgeon in the UK and Europe, and you spent a good portion of your medical life researching immunology, and you have such a great depth of knowledge. So welcome in again. It's just wonderful to spend conversation time with you.
Thank you very much, Pat. Always a pleasure. It doesn't seem to matter how deep you go in immunology. There's always a lot deeper to go still, but we try and keep it simple.
I tell you, I've learned a lot, and I hope other people have. If this is the first time that you're watching this, be sure you hit the bell below and subscribe, and that way you'll get notified when we have new information, which we're putting up new information pretty often. Well, Charles, let's dive in today, and I know we're going to talk about something that I know is very personal to you in terms of experience with your family. But help us understand this post-viral syndrome. We've heard a little bit about it related to things like long COVID, but you would tell us it's much broader and deeper than that. So help us understand that a bit.
Well, post-viral syndrome, there are different names for it. People might have heard of it as myalgic encephalopathy, yuppie flu. I mean, there's a whole bunch of, fibromyalgia. There's a whole bunch of, if you like, dustbin terms for the condition. And until COVID came along, I suppose every cloud has a silver lining. Most doctors did not really treat it as a serious condition. Somebody would go along to see the doctor and they've got the symptoms, and the doctor would say, well, listen, I mean, basically what they say is, look, you just got to man up. It's just one of those things. It's in your
Toughen
head.
up.
Yeah, toughen up, go. Yeah, exactly. So, and it's very frustrating for the patient who isn't being listened to. And to be fair to the doctors, I'm a doctor myself, so I can be as abusive as I want to them. But to be fair to the doctors, the reason is that if you do the standard blood and biochemistry and other tests on these patients, they're normal. It's very unusual to get an inflammatory response or something that shows a serious change. They might have minor changes in their monocytes or eosinophils or whatever, but it's trivial. And the doctor just says, look, there's nothing wrong. I can't see anything wrong, so there can't be anything wrong, which of course is nonsense. So what we've learned from long COVID is that it exists, it's nasty, and it's very, very, very common. Now, the figures for long COVID go from 20, 30% short term to 8, 10, 20% even long term cases. I mean, the figures keep changing because the more you look, the more you find. It's very difficult.
Is it just a continuation of certain symptoms, or does it kind of morph into something different?
Both. You get the symptoms. So sometimes with COVID, you get some nasty inflammatory changes in the heart and in your vascular system, as you probably read. But you also get the mental health issues, which, the debilitation, you don't feel right, can't get out of bed, all these other things that are much more difficult to assess. So to be fair to the doctors, what they needed to discover, and we now know, is that the only way to work out that something isn't working properly sometimes is to run the engine. So the analogy, and I teach by analogies, is I have a car, and one day, as I was trying to overtake on the road, the car started to stutter and didn't work, you see. So I went back in again, and it did it again. But when it was idling, it was fine. So I take it into the garage. The mechanic plugs in, they don't look at the car anymore. They just plug in.
Just plug in diagnostic.
There you go. And said, well, there's nothing wrong with your car. So I said, don't tell me there's nothing wrong with my car. Feeling like one of these poor patients with post-viral syndrome. Yeah, I'm telling you, when I try to overtake and run the engine, I nearly get killed because there's a car coming in the other direction. Oh, all right. Well, I'll get in the car and drive it. And it's only when they get in the car and they run it that they say, okay, yeah, now I know it's whatever it is, the thing on the left that you got to fix, and we'll sort it out. So the same thing applies with the immunity signals that we look at. If you look at the immune cells in the body, you have to do a test where you trigger those cells into having to work hard, and you give them a toxin or some agent that makes them replicate or produce, it's endotoxin or something like that, and drives the effect of those cells. And then you can see that they're not functioning properly.
So you're flushing them out of the bushes, basically.
Exactly. So then you say, aha, yes, your immune system isn't working properly. And the patient says, yeah, I know that. I told you so, you see. And so the patient, yeah, patient's always right. You got to listen. And we're not good at listening, us doctors. So this is the point about the post-viral syndrome. And if you like, the thanks we owe to COVID, which I don't like to do it, but it was only the vast numbers of COVID that really made it very clear that this is a reality. So we then go back and we realize, hang on, this has been happening with flu. This has been happening with Epstein-Barr virus, glandular fever that we know about. It's been happening with some nasty colds. And on a personal basis, I've told you the story.
You got a very personal
again. My elder son, who was when he was 17 some years ago, I sent him out on a trip to Africa to get work experience before university. And he was a big, strapping 6'1" lad, would play football, whatever. He caught both Epstein-Barr virus, nasty version of Epstein-Barr virus, the African one. And these can produce cancer, by the way. And Epstein-Barr virus, one of the first viruses that was known to produce a human cancer.
Wow.
And he also had a condition called toxoplasma. Toxoplasmosis is a parasite and again can cause debilitating long-term effects. So he got not one, he got both, a double whammy. Wow. And my strapping son was sick for 12 years. He was dead almost for 12 years. He shrank away into something that looked like a skeleton. And I was supposed to be this great doctor. I knew everybody. I took him to see everybody. We did every test we knew about back then, and there was nothing we could do. And he kept saying to me, sorry, Dad, I'm trying to man up, etc. And I said, look, you have to apologize. I know this is not your fault. And then we started the work on the Mycobacteria, the sister organism that we were developing for cancer and, the pharmaceutical grade, not IMI, but very close. I decided that as part of the initial study of any new drug, you have to have volunteers who will take the drug to look for toxicity, etc. So I was the first volunteer because I wouldn't give to another human being something that I wouldn't take myself. Wow. And I survived. My dear friend and colleague, who sadly no more, Professor John Grange, took the second dose and he survived. And I thought, do you know what? I'm going to give the boy the third dose because I knew it had this immunomodulating effect. And it was amazing. Within 2 days, he was like Lazarus getting up, picking up his bed and walking. It was a fantastic treat. For 12 years, he didn't want to eat. He didn't want to get up. And he woke up and he said, I feel hungry. I want to get up. Something's happened. The switch has gone. What's happening? And by the way, that switch lasted about 4 to 6 weeks. And then it started going off again. We had to give him another dose, which had the same effect. And then we moved on from there. And but the pride I have, if you like, and I tell people this story, it's N equals 1, you can believe it or not. But if I achieved nothing else in my life, I cured my son of the condition. And he was lucky. Not everybody responds, but we think that by improving your microbiome, which we've worked on with him, by having a good agent, an immunoadjuvant, just like IMI, and basically a bit of exercise, don't smoke, don't, try and be happy. It's amazing what you can achieve.
Dr. Ackle, what an amazing story. And you're so humble, you're not going to say it, but what amazing courage for you to take that first dose and to go, okay, let me make sure that it's stable and that, that I can apply this. It all goes back to great health begins in the gut. It begins in the immune system and the body's ability to be able to fight back. And then the connections back to a healthy microbiome, and all of those elements working together is just a fascinating story.
Well, there you go. I mean, again, in simple analogies, if you like comics and things, I love comics, even at my age. But Wolverine, many of you
Yeah,
will have heard of, has got his healing
with the
factor.
hand.
Yeah, what about the hands? That's not so clever. But his healing factor, if you think about it, the immune system is exactly that. It is the defensive, protective, it's the reconstructive and reparative process of your body. It's what makes you function. And by the way, it's what makes you happy. You've got a good immune system, you
Right,
feel good. You've got a lousy immune system, you've got a nasty cold, and you feel lousy.
right.
So it's not difficult that the whole thing is interlinked. But Wolverine, we're not quite up to Wolverine standards, but you got to make the most of it. And if you want to heal, you got to look after your immune system.
Absolutely. Well, great to talk this subject with you. It's fascinating. We could go on for an hour. If you've enjoyed this conversation and you want to make sure you get notifications of future ones, be sure to tap in to the subscribe button below. And also, if you'd like to learn more about Emmy, be sure to go to emmy.co. That's IMMY.co. You'll learn all about Emmy, Myceliaceae bacteria, M. aurum, Algashima. And we look forward to seeing you there. So, Dr. Ackle, thanks again. Let's do this again soon.
Look forward to it.